Good morning. I'm Sydney Benter with Austin Public Health. We appreciate you joining us this morning. Spanish interpretation is available on ATX N3. First, we'll hear remarks from Dr. Desmar Walks, Austin Travis County Health Authority, followed by Janet Pichette, Austin Public Health Chief Epidemiologist. Then Cassandra De Leon, Austin Public Health Administrative Officer for Disease Prevention and Health Promotion Division. Finally, Adrienne Stirrup, Interim Director, Austin Public Health. Let's begin with Dr. Walks.
Good morning, Austin Travis County. We're here to talk about the situation that our community finds itself in with regards to the Omicron surge of COVID-19. On the slide that we're going to share with you right now, you will see that the number of cases in our community has surged dramatically over the past several weeks as a result of this more rapidly spread variant of COVID-19, Omicron. It replicates 70 times faster in the airway and fortunately does not seem to infect the lung tissue as much, but because there's so much virus in your airway, whenever you talk, cough, sneeze, sing, shout, and you're not masked, you're able to spread this virus much more quickly to others, which is why masking is such an important part of what we've used in the past previous surges seen here on this graph to help us get our numbers down and to use that term that we're also familiar with, flatten the curve. Because we're getting so much infection spread so quickly in our community, this Omicron variant is finding the medically vulnerable, and that's the thing that we are so concerned about. We're seeing increases in our hospitalizations, particularly in those who are not protected by vaccine, and in those people with medical conditions that make them more vulnerable to having severe disease requiring hospitalizations, and that's the thing that we want to stop. We know that when our children get sick, we have to take off work. We know that we are facing right now in our hospital systems decreases in the number of staff to start with, and because this thing is spreading so fast, staff are getting sick. Relief contract staff that the state has sent to help us during this time are also getting sick. So we have to do what we can as a community to stop the spread. With that, I just say what we've been saying for many, many months now: wear a mask indoors and in outdoor settings where you can't socially distance. Stay home when you're sick, and please get vaccinated and boosted if you're eligible. And with that, I'll turn this over to our Chief Epidemiologist, Janet Pichette.
Thanks, Dr. Walk. Good morning, everyone. As Dr. Walks mentioned, we are at a state in Austin Travis County and throughout Texas in the United States where we have widespread community transmission occurring. It's unprecedented right now that basically anyone you may encounter may have COVID, and while they may have mild symptoms, they are still extremely infectious, as Dr. Walks pointed out. You need to be very, very careful about who you encounter and make sure that you do everything to protect yourself and your family at this point. As Dr. Walks also mentioned, all of our operations within the city of Austin and Travis County are currently experiencing a surge. That includes the healthcare system, that includes all public health response systems, testing operations. Our isolation facilities are reaching capacity. In fact, we opened a new isolation facility this week, and it is nearing capacity as well. And, we also still have vaccine operations going on. But again, just to give you an idea, our case numbers are just basically climbing through the roof as we anticipated they would. And based on what we're seeing at other parts of the world and the United States. while we're seeing a significantly steep incline in cases, we can't keep up with the demand as we do our case data entry, case investigation. So even if you have a positive PCR case, you may not hear from Austin Public Health because we are still processing thousands and thousands of cases that are positive and trying to investigate as many as we can. But we are at a point where we have a lot of cases that we're processing on a daily basis and trying to work on solutions to automate some of that data entry so that it can give us a better idea of what's occurring. There's also widespread self-testing taking place, so the numbers that you may see reported to CDC, the state, or to Austin Public Health are just those that are laboratory confirmed. So there's very much a situation where we have underreporting of disease in our community at the current time. I will point out that we do have our test positivity rate, which CDC is reporting out to be 33%. So for all those people that are testing, 33% of them are considered positive, which is pretty high. However, our own internal measures for test positivity rate in the community is much higher. It's about 36%. That's from what we're seeing in Austin Public Health testing operations, and it includes regional partners as well. But if you do need to get tested, there is testing taking place in the community in a variety of locations in private spaces, but also Austin Public Health has testing that will be occurring obviously at the Travis County Expo Center located at 7311 Decker Lane. Those testing operations operate from Monday through Friday from 8 to 2 p.m. And then on Tuesday through Saturday from 8 a.m. to 2 p.m. There's testing offered at the George Morales Dove Springs Recreation Center located at 5801 Inez Drive. So and those are listed on our website if you need to get more information about testing. But if you do try to get tested and those options are available to you. If you do come down with symptoms and you're not able to test or you can't find a test solution, you need to isolate at home. You need to isolate until you are able to get a test, but isolate yourself from others so that you aren't spreading disease within your household. And with that, I'll turn it over to Cassie DeLeon.
Thanks, Janet, and good morning. And Happy New Year. I think what we are unfortunately did not expect that 2022 would ring in with us being in stage 5, but here we are. We do know that some of the important things that we're learning is that those that have been vaccinated are faring much better. They may still contract the Omicron variant, but we're seeing that they are not suffering severe disease. And they're staying out of the hospital. So that's really exciting to note that the vaccines are proving to work during the surge. And so we just want to come and talk about the vaccine and the importance of vaccine. We still have a significant number of our population that still has not been vaccinated. So we just want to encourage folks that it's important to get vaccinated. It's important to get your child, if they're between the ages of from 5 years old and up, they're eligible for vaccine, and we want to get all of them vaccinated so that they're protected. And then if you are vaccinated, we know that research is showing that vaccine immunity does start to wane over time. And so new updates regarding Pfizer and Moderna vaccine has indicated that they have now updated the guidance and the recommendations that if it's been 5 months since your second dose, since you were fully vaccinated, it's time for you to get a booster. You're recommended to get a booster. So it's time to get your vaccine cards out and look at it and get boosted. That will just ensure additional protection throughout this pandemic, and to make sure that you have all of the resources available to you to help fight this disease. In addition to that, we really are trying to focus on areas that we're seeing lower vaccine uptake in geographic areas. We're doing a lot of outreach
and education. We did over 5,000 calls into specific zip codes last month that were experiencing lower rates of vaccine. And so we're really wanting to make sure that people are aware of the importance of vaccine and aware of the resources available so that they can make that personal health decision to best protect their family. This is an unprecedented time. This surge is like nothing else that we've ever seen, but we are seeing that vaccines have been very effective. And so this is a time to really think about getting the vaccine to help, and those who are already vaccinated, that's going to help you through the surge. If you're not boosted yet, it's time to get boosted so that the next surge, the next variant that comes along, you'll have that additional protection. We just want to make sure everyone has all those tools available. And at the end of the day, we really know that vaccine not only protects individuals that have been vaccinated, but also helps protect those who can't get vaccine. We're seeing these numbers. I hate that my child might be more vulnerable simply because they're not eligible to get vaccinated. And so this is the time to really think about that, think about your personal choice that protects you, but also protects other individuals in the community who are vulnerable or who still just can't get vaccinated yet. So we have opportunity now to do what we can to protect ourselves during this surge and then also protect ourselves throughout this pandemic. And with that, I'll pass it over to Adrienne.
Thank you, Cassie. Good morning, everyone. Cassie, you hit on some really key points, and the one I'm focused on is like as a mom of a teenager in a high school environment, I tell him all the right things to do. I give him all of the information, and then I give him the tools that he needs to keep himself safe. He's got his purple mask that matches his purple mohawk. He's vaccinated, and we're scheduling his booster appointment because he's right at that 5-month mark. And that's what we're trying to do for our community as a whole. We know that there's a lot of information out there, so we are doing our best every day to make sure that you have the most accurate and up-to-date information matched against national guidance, and then measures and resources to use those informations and tools that we give you to keep yourself and your family safe. So, the bottom line is we know that COVID is in our community. We know that it's highly transmissible. We know that we have friends, families, and loved ones that we're hearing more and more every day that have COVID. So what can you do? It's back to the basics. Wear your mask. If you're sick, stay home and get tested. We had a great push before the holidays to give out home test kits in collaboration with our Travis County partners at our neighborhood center sites. And we are stocking up to be able to do that again. And we plan to, once we get our supply in, resource those neighborhood centers that are connected to food pantries, as well as support our community partners that are doing good work in places and spaces where we might not have the influence or reach. We're also working to expand our testing opportunity because there are some folks who want the PCR test. And so we're working to gather resources to be able to expand our capacity to give up to 1,000 additional tests per day in our community. We're also making sure that we are where you need us for vaccine. We have our static locations, we have our mobile vaccine programs, and then we have those programs that are particularly focused on equity. Something that Cassie touched on earlier. We know that we have zip codes as well as populations, specifically our Black and Latinx residents, that are not experiencing the same level of vaccine protection that we know is needed. And so we are very intentional in our direct efforts to make sure that vaccine is available in those communities. And we also continue to support community-based organizations that do that good work in community on our behalf. And so, as I've always said, the information can be daunting, but we do have the information and we have the resources and the tools at our disposal to make a difference. And so I encourage everyone to not only think about your personal health and the health of your immediate family and loved ones, but our community as a whole. And with that, I open us up for questions.
Yes, so our pool reporter today is Grace Reeder from KXAN. She's going to ask questions on behalf of news outlets. So I'll turn it over to Grace.
Good morning, everyone, and thank you so much for your time. We're going to start with a question from us here at KXAN. If hospital numbers are inflated because so many people are testing positive when they go in for non-COVID-19 treatment, is the hospitalization metric still one that people should be looking at, or is there one that's more meaningful for people as they look at these numbers?
The hospital numbers that we're reporting are those that are required by the state, and we are giving the number of people who are impacted by COVID and testing positive. There are people who do go in for COVID-related illness, and there are people who go in for other problems who test positive for COVID. And COVID-19 can impact the course of healing, length of stay in hospitals. So it is relevant that those numbers be reported alongside those who go in for COVID-related illness. The second part of your question regarding the metrics to look at with regard to what's happening in our community, metrics that would help you know what to look for as you're going out into public spaces would be the community transmission rate. And our community transmission rate indicates that if you go into a public space, you are likely to encounter somebody who has COVID-19, the Omicron variant, and it's important that you're vaccinated and that you wear a mask to fully protect yourself.
The next question from the Austin Chronicle. Can you please provide an update on APH's work to get more free at-home test kits to residents?
Thank you. I think I touched on that a little bit earlier, but we are in the process of sourcing additional at-home test kits to be able to provide in partnership with Travis County and our other community partners. In addition to that, we are working to expand our drive-up and static sites so that folks who are not comfortable doing the swab on their own can come on through and we can get that test done for them.
The next question from the Statesman. When comparing the Delta surge over the summer to the Omicron surge today, which surge challenged our local healthcare systems more? Please explain your reasoning.
The Omicron surge comes at a time when our hospital and healthcare systems are experiencing lower numbers of staff to take care of patients, and because of its rapid spread throughout our community, we're seeing large volumes of people who are becoming ill. And on top of that, in healthcare and other aspects of our service industries, our staff in hospitals and healthcare clinics and healthcare settings are getting sick. And so that is a challenge because that is where we go to get the care that we need. So this surge has proved to be much more challenging.
The next question from CBS Austin. Other parts of the country are starting to see the Omicron surge level off or even start to decline. Some predictions are that Austin will follow suit sometime next week. Does your information and modeling agree with that?
Modeling can't predict human behavior, and so it really is going to depend on the community's response to the clarion call to arms. And in this case, that's putting a mask on and getting vaccinated. As we've seen in many studies, masking improved by 10% is able to reduce community transmission significantly. And we are seeing a trend in increased masking in our community. And so if that continues, if people continue to stay home when they're ill so they're not spreading the illness, we could possibly see this turn around in the near future. But it really depends on us.
The next question from Univision. We've seen cases where children in our area have been co-infected with COVID and the flu at the same time. How common is that?
This is the season for respiratory illnesses, and my colleagues in the pediatric world say that they're seeing children present with COVID and many other respiratory viruses, RSV, the flu, and all of those things can be seen more so during this time of year. So right now we are seeing children who are infected not only with COVID but other viruses, and that's concerning.
And I'll add, we are at a new point in time where historically in the past we may have been focused on doing flu surveillance, and our providers may have been, if someone presented with influenza-like illness, they may have only been tested for flu. We didn't have the capability to freely test for COVID. So we're actually actively looking for all these other respiratory viruses at the same time now, whereas maybe in the past we didn't do that.
Next question from Co-op Radio. Does having contracted or even being exposed to COVID preclude one from donating blood? If so, for how long?
Blood donation typically is something that's done when people have recovered from illness, and so that would be a call that would be made by the person's healthcare provider, and then they would be sent to the blood bank according to the recommendations of their healthcare provider.
And I'll just add that the blood bank may also have some criteria that they're screening to make sure a person is past their infectious period before they're able to donate.
Next question from KUT. Can you comment on the current status of hospital and ICU beds and the rate that they're filling up? How does this compare to previous waves?
We have had a period of rapid rise in the number of cases, and that rise in hospitalizations has also increased. We've surpassed our number of daily cases quickly with this surge, and we're seeing a 20% 1 in 5 entry into the ICU. So this is a little different from other surges in that it's evolving and unfolding more rapidly, but we're still seeing the need for ICU beds. And if you look at this setting now, we have less ICU bed capacity because we have less staff. So this is a much different situation because of our staffing challenges, and we as a community need to do all that we can to decrease the spread, particularly to those who are medically vulnerable and who may be at more risk to need those ICU beds. And so it's very important that we continue to mask, and it's very important that we get vaccinated and boosted if we're eligible for boosters.
All right, next question. With new orders in place, what would enforcement look like for businesses required to place signage on doors?
Our goal as a public health department is to do just that, to make sure that we are protecting the health and safety of our community. The new orders are more about helping business owners understand their rights and the flexibility of choice to protect their employees and their patrons.
We're moving on to the second round of questions now. So this one is back from us at KXAN. Has anyone in the Austin-Travis County area started receiving COVID-19 treatment pills? If so, how are those being used and how is it working?
We have a very limited supply of the outpatient treatments for COVID-19, and they're being used according to the guidance and the approved ways of use through the FDA and the National Institutes of Health. And we are seeing that the patients that are receiving these treatments to date are having good outcomes, but it's really too early to give you expanded information on that since we have very little data at this point and very little supply.
Next question from the Austin Chronicle. Why does Austin's community transmission rate continue to outpace the state's?
I think the answer is in the term itself. It's a community transmission rate. And so it is part of a community picture of what's happening. And we as a community know what we need to do to stop the spread of this disease in our community, and that is to wear masks. Masks that fit properly, masks that don't have gaps between the mask and the skin, and masks that are worn over the nose and mouth. And in addition to that, we need to, as a community, get vaccinated or boosted, and when we're sick, stay home.
Another point that may affect our number being higher is that we may have a responsible community in which they are sick, they do get tested, and therefore they are counted as a case, which those case numbers tend to feed into that rate itself. So it could have an impact because people are being more mindful and trying to do the right thing. So again, as Dr. Locks has mentioned, we need to do everything we can to protect our community now. I'm sure all of you know at least one person who has got COVID within the last few weeks, or your workplace is affected by it. We have a lot of people who it's basically taking out entire places of employment because everybody in that location is sick. So we need to do everything we possibly can to try to limit disease transmission risk. And one of the key ways is to make sure that we're masking, because obviously what we're seeing here in the Austin-Travis County area is that people are having very mild symptomology, runny nose, congestion, sore throat. They may or may not have a fever, but just kind of feel tired and puny. And as a result, they could be infected with COVID-19 and the Omicron variant, and it can be rapidly transmitted. So even with those mild symptomology, people need to stay home when they're sick and isolate from others and try to get tested if they can. If they can't get tested, just stay home and isolate from others and protect those around you.
The next question from the Statesman. Does Omicron affect children as severely as Delta? Are we noticing an increase in hospitalizations for kids in recent weeks as a result of the new variant?
In talking to pediatric colleagues, they are seeing increased numbers of children who have COVID-19 and this Omicron surge. And those that require hospitalizations are as sick as the children that they saw in the Delta surge. However, those who are vaccinated are and presenting to hospital do have some protection, and And typically those who are ending up in hospital who are vaccinated are those who have other medical conditions that put them at risk for more severe illness. So all of the things that we've been saying with regards to protecting ourselves and our children apply in the Omicron surge and will continue to be the gold standard for how we're going to get through this.
The next question from CBS Austin. Should people be concerned about getting reinfected with Omicron? Is it possible to recover from one bout and being reinfected and transmit it to others?
I'll answer that. So yes, we are seeing people who are experiencing reinfection. We've seen it throughout the course of this pandemic. Continue to see that. We're seeing breakthroughs as well. The more people that are vaccinated, the odds of us seeing breakthroughs are going to increase over time. But again, the vaccine was not supposed to eliminate disease. It was supposed to reduce the severity of the course of illness that you have and decrease people going to the hospital with disease. And I think that part of it is working. We are seeing that people who have been vaccinated and boosted are having much milder disease than those who are unvaccinated. So yes.
And I'm going to pull a Betty on this question and ask a follow-up to that, because I think a lot of people are confused about this. So if you get Omicron right now, right, I think a lot of people are asking us, well, can I get it again in the next few weeks, in the next few months? So what is the level of reinfection that people should be concerned about?
So you can be reinfected, and I'll leave breakthroughs out of that because you could be reinfected whether you're vaccinated or not vaccinated, right? But typically we follow strict guidance from CDC and the Department of State Health Service of what constitutes a reinfected case. And typically you can become reinfected beyond 90 days. So if you had a course of illness where you had it 1 month, 90 days later, if you develop disease after that 90-day window, you are considered a reinfection. Now, is there a possibility you could get reinfected before that? I'm sure there is. So, and we are considering those that come across, but yeah, there's definitely possibility of reinfection, and we are seeing it pretty widespread within our community.
And just to add on to that, when Omicron first emerged in South Africa, that's what was seen, that people who had previously had COVID were being reinfected by this new variant. And so it's important that we do all that we can to protect ourselves from becoming infected from this variant and anything else that may emerge going forward. Because every time a person is able to be infected, that gives this virus the chance to mutate. And the way that we're going to bring this spread to a halt is by addressing the things that we can to stop the spread and stop the virus's ability to mutate so that we can go on with our lives in a situation where we are able to take our kids to school and go to the grocery store and go to our jobs and know that we are doing all that we can to protect ourselves.
Thank you for that clarification. This next question is from Univision. As time has gone by, what have we learned are the differences between the Omicron and the Delta variant, especially for unvaccinated individuals?
I'll start. What we know is that if you're unvaccinated, your likelihood of suffering severe disease is much, much higher, regardless of the variant. And so, regardless if it's Delta, Omicron, or even previous variants of COVID that we've seen. So we know that vaccine works and protects you. And if you don't have vaccine on board, the likelihood that is much higher that you might suffer severe disease, hospitalization, and even potentially could die from this. And so we want to always encourage folks to get vaccinated. If you're not boosted and it's time, get boosted, and you're eligible, get boosted. And for those younger populations that are newly eligible, they need to be vaccinated as well, because what we are seeing is those populations that don't have vaccine, and particularly younger populations, are getting Omicron, they're coming into the hospital, so we know that they're particularly vulnerable. So we know that we saw this in Delta, we're seeing it still in Omicron, that the unvaccinated individuals are much more at higher risk from suffering severe disease and other complications from this virus.
The next question from Co-op Radio, and I am directly quoting this question here. Current school guidelines are at best a confusing jumble of local ISD, TEA, and CDC recommendations overlaying personal choices. What is your best advice to parents and staff?
If you are sick and you do not have access to a test, you should stay home and isolate for 10 days. If you test positive and you should stay home and isolate for 5 days, test at the 5th day, and if you're positive, continue to isolate at home. If you're not able to go back to a situation, and consistently wear a mask when you're around other people and in settings where you're eating and removing your mask to eat or drink. It is important that we continue to take the measures that we've taken in the past to decrease spread. And the last 5 days of the new guidance require that masks be worn consistently for 5 days after and the last part of that isolation period or quarantine period. And it's important that those 5 days of masking be adhered to. So in any situation where that cannot occur, then the 10-day isolation at home should be the fallback position.
And I wanted to add, related to quarantine, if you're exposed to a positive person, quarantine starts the day of your last exposure to that person. So if you cannot safely quarantine from somebody who's positive, like your child, you need to go out through that 10 days as well, because the clock restarts for you based on the date of your last exposure. So, and quarantine doesn't mean I can put a mask on and go about town and do whatever I need to do. Quarantine means you need to be staying at home and keeping yourself away from those, especially those who may be vulnerable. And monitor yourself to make sure that you're not developing disease, even if it is the slightest of sniffles.
This next question from KUT, is the alternate care site ready for immediate use if needed, and how many staffed beds would be available?
The alternate care site is in a what we call warm ready state with 50 beds. However, we don't want to get to the point where we have to use that alternate care site, right? We want to make sure that we protect our healthcare system. If we get to the point where we're needing the alternate care site, we're in a bad place. We need to not get there. We need to, as a community, stop the spread of this disease. Wear a mask, stay home when we're sick, get vaccinated, get boosted. And in addition to that, take those precautions that you would to make sure you don't get in a car accident. Don't drive while you're intoxicated. Wear your seatbelt. it's important that we do those things right now, so that we can continue to enjoy our way of life, have the supply chain so that our grocery shelves are stocked, make sure that we can go to school and drop our kids off at school, or have bus drivers to drop them to school, be able to go into a government office and get the service we're looking for. This is the time for us to pay attention to putting on a mask that covers our nose and mouth and get vaccinated.
This is the final question. The parts of the business order that say proof of vaccine, negative test, etc., businesses can implement those policies on their own discretion. Is that correct? The order is not saying that those actions are required.
That is correct.
That's the final question. Thank you all.
All right, we want to thank our Health Authority, Dr. Walks, APH Interim Director Adrian Stirrup, Chief Epidemiologist Janet Pichette, Chief Administrative Officer for Disease Prevention and Health Promotion, Cassandra De Leon, and to our pool reporter today, Grace Reeder from KXAN. We appreciate everyone joining us. Have a safe weekend.
Will Dupree once again in the KXAN live studio. Thank you all for sticking with us as we brought you that briefing from the Austin Public Health and the experts there at that agency. They are once again telling everyone to put masks on because community transmission of this more contagious Omicron variant of the virus that causes COVID-19 is, quote, unprecedented. They said that test results are coming back at 36% positive. That is higher than has previously been reported. And what the chief epidemiologist for Austin Public Health, the woman who studies the disease and its transmission in our community, she says that we should all assume that when we go out in public, that the people that we encounter, someone may more than likely have COVID-19 caused by this Omicron variant. This variant is about 70 times more transmissible, so it's very easily spread. That is why these experts are urging people to put masks on over their nose and mouth whenever they are in an indoor setting around other people and outdoors if social distancing is not possible. They are really reminding people that the hospitals are really short-staffed at the moment because hospital staff members are also getting sick, which prevents enough care being provided to those facilities, and it's really straining the resources again. And they say that there's an alternate care site available and ready to be stood up if it's so needed, but they're asking all of us to do what we can to prevent that from happening because they would prefer not to have to do that because the situation had gotten so bad. I just want to point out really quickly the numbers in our area. The number of active cases has gone down in the last day. Right now there are about 5,300 active cases of COVID-19 in Travis County reported by Austin Public Health. Again, the experts said a few moments ago that number is likely higher because so many people are using at-home COVID tests, and those particular results are not shared with Austin Public Health, the state, CDC, etc. Additionally, we have 563 people in the hospital in our area right now with COVID-19, 127 in intensive care, and 63 on ventilators, meaning they have to have a machine to help them breathe. I want to point out something really quickly, too. We are right now reporting in our reporting partner at borderreport.com this Omicron subvariant being discovered in South Texas in a border county there. This is in Hidalgo County. You can read about this particular story over on KXAN.com right now, so I'll direct you there if you would like to find out a little bit more information. But again, because this virus is spreading among so many people, the chances of it mutating and changing even more are highly likely. Dr. Desmar Walks just spoke about that. So if you'd like to read about this particular story, again, the headline is "An Exclusive Omicron Subvariant Discovered in South Texas Border County." It's available right now on KXAN.com. Thank you all again for watching here on KXAN Live. I'm Will Dupree. We will see you back here throughout the day with other updates, so please stay with us. And again, more information and coverage about COVID-19, those new business orders that went into effect and are going into effect on Monday. You can find it all on our website and our smartphone app. Thanks again for watching. We'll see you back here another time. Everybody, please stay safe and healthy out there. Take care.